In Senegal, in the districts of Ranerou, Kanel and Linguere, the National Malaria Control Program and PATH are working together on malaria elimination activities. Partners are implementing innovative strategies for testing and timely treatment of malaria infections.
Le district a intégré le projet de réduction de la transmission du paludisme au niveau du Sénégal, à l'instant donc des autres districts que sont Ranerou et Kanel. Et nous sommes donc accompagnés dans ce projet par l'ONG MACEPAPAF, donc qui nous aide à atteindre un objectif qui est un objectif de préélimination au niveau de ces 3 districts.
Le programme national de lutte contre le palud a en fait une vision d'un Sénégal émergent sans palud d'ici 2018. Dans ce cadre, il a élaboré un plan stratégique 2011-2015 de préélimination. Et après évaluation à mi-parcours en fait, de ce plan stratégique 2011-2015, un cadre stratégique 2015-2018 a été élaboré pour réorienter ces stratégies par rapport à la préélimination d'ici 2018.
The project aims to reduce local transmission of malaria and expand ongoing elimination efforts in the northern part of the country, where transmission is already less than 5 cases per 1,000. In these 3 districts, the National Malaria Control Program and PATH implemented a mass testing and treatment campaign early in the rainy season when disease transmission is high. All households in the targeted areas were visited in September 2014, and all consenting individuals were tested with a malaria rapid diagnostic test, RDT. All positive cases received treatment with an anti-malarial drug. The systematic identification and treatment of both symptomatic and asymptomatic malaria infections further reduces the transmission of the parasites and paves the way to pre-elimination. In the district of Linguere, the Gassan Health Post has been selected to conduct this ambitious project.
Pour toutes ces zones, une stratégie particulière doit être adoptée pour arriver à une incidence nationale de moins de 15 pour 1000. Donc ce qui fait que dans cette zone nord, des stratégies de préélimination avec le mass screening and treat, le focal screening and treat et enfin le focal test and treat donc sont mises en œuvre en fonction de la situation des villages qui sont concernés par le projet.
Implementation of this malaria reduction plan in these 3 districts were established based on 3 different strategies. During the rainy season, participating villages were stratified into 3 groups. Red villages, where malaria incidence is higher than 15 cases per 1,000 per year. Yellow villages, where malaria incidence is between 5 and 15 cases per 1,000. And finally, green villages, where malaria incidence is less than 5 cases per 1,000. In the red villages, a mass testing and treatment strategy was implemented in September, followed by Pecadum++. Household visits conducted weekly throughout the transmission season to identify fever cases. All fever cases are tested with a malaria rapid diagnostic test at the household, and then if the RDT is positive, the case is treated and the entire household is investigated and tested with RDTs. If the RDT is negative, community health workers provide counseling for malaria prevention. In the yellow villages, Pecadum++ or mass screen test and treat was implemented from September 2014 to January 2015. In the green villages, case investigation of all malaria cases diagnosed at the health post was conducted. The households of the cases are visited and all household members are tested with an RDT and treated if positive. Focal test and treat. The 5 closest neighboring households are also visited to screen for risk factors, and all individuals with a fever, a history of travel, and not sleeping under a bed net are tested with an RDT and treated if positive. Focal screen, test, and treat. During the dry season, all villages conduct systematic case investigation of any malaria cases diagnosed at the health post with focal test and treat and focal screen, test and treat at the households level. The objective is to rapidly reduce transmission in those districts, bringing them to pre-elimination and, in other words, less than 5 cases of malaria per 1,000 per year. This strategy requires the mobilization of significant resources, including human resources. Activities in Kanel, Ranerou, and Linguere demand a coordinated effort of 80 teams with a total of 180 people in the field. This represents major logistical complexity due to the remoteness of many of the villages.
Liggéey fa néew na nangaan kay mbogom yo a ñoxoro si bidi bo si bidi def katena Senegal kene ref o jaf in mbugane koy mit nu ta moƴna faaxit mbugane mi no te i mbay formation ne Linguère ka fina pe a tadak nan gilwayo teyo te wax deg te ref liggéey fa na ando naye a felay in.
Data collection was done with smartphones, and collected data was sent to a server every day, allowing access to data in real time.
Mi sambatin danaka mulami xotami engagement pour xex ñoxore ci bidorene ba jeg kate me to fogami awagay ref je repali je m'engage.
The results of the study conducted in Linguere, Ranerou, and Kanel will inform future health policies for the elimination of malaria in Senegal.
Ma set pa e PNLP